A large part of building social capital is a healthcare program, community-managed healthcare for people who have little to no access to any other healthcare. Health services and education are provided through clinics, or, in less stable areas, they are provided through backpack or mobile medical teams. In 2012, our health program provided primary health care to a target population of well over 500,000 people. Dr. Cynthia Maung is the director of Mae Tao Clinic. Mae Tao Clinic is one of our large partners in the health program. She was forced to flee Burma in '88 and has been providing critical health care to people from Burma for 25 years now. When Dr. Cynthia and 14 of her colleagues fled Burma, it took them 7 nights of walking through the jungle. They passed through remote villages where many people had never seen health workers. And when they could, they tried to treat people suffering from diseases and injury with what supplies they carried. After some initial time in a refugee camp, Dr. Cynthia with some colleagues set up a makeshift clinic in a dilapidated building on the border with Burma. This was the beginning of Mae Tao Clinic. The clinic's facilities and activities continue to grow to this day. Currently, between 400 and 500 people come to the clinic each day, and there are about 700 staff members providing comprehensive health and child protection services.
I remember her. I remember Dr. Cynthia meeting her back in 1988, and she just set up this the Mae Sot Clinic in this barn in Mae Sot with just a few other people, and there were Burmese students lying on the ground and all had malaria, and I never thought that it would grow into this huge operation.
Initially was the program we would like to set up is to respond to the emergency needs, health and humanitarian needs for the displaced people. During we start the program, thousands of students and civilians flee to the border because of the oppression inside Burma.
How do you see your work at the clinic connecting to other organizations and to what's happening in Burma right now?
Actually, our patient, almost 50% come from Burma. So every year we have seen that the humanitarian and health impact result of the human rights violation is always far beyond health. Many of our patients, while they come to the clinic, you have to help them or have to comprehensively approach different way because of sometimes they come with like unsafe abortion, but they have gender-based violence issue, or they need some support for like children education, or so we always have to try to find a way to link or to network with other civil society organization or government services, so that we have to find our partner and then standard of care for these children or women. And then also through the partnership with the different groups or organization, we learn from each other and we share our resources and skill. So it makes more confidence for us to work together and to make better outcome for each case. When we do the case management, there are always ongoing discussion and follow up for these all cases. So make sure that the community involved in this or management for individual as well as make a case study. This is not only the health program or health services need to be intervened, also we need to work comprehensively.
I've known Cynthia for a little over 20 years, and yet when I did the video interview, I found it almost impossible to get her to talk about herself. And thinking about that, I realized, in my experience, the best leaders almost never draw attention to their own role. And Cynthia her leadership works that way. I think the two main aspects that make her a good leader are, first, she leads by example, by setting an example and then leaving others to follow it. And then secondly, she deliberately creates opportunities for other people she works with and responsibilities, and gives them the responsibility so that they can follow her example and become leaders in their own right, while owning part of what they do and feeling they're an important part of the team. That's how I think her leadership works so well.
She's inspirational. She's a real leader. She's inspirational, and yet she has humility, and she's always out there doing a job. She provides, her focus is very clearly around an identified need, and that is what she is addressing. And not only does she do it in a practical way, she's not afraid to step outside and speak out for where she sees there is injustice. And what shines through is her commitment to the work, to the people, and she brings in others. She networks, she looks outside of her own community to see how else she can engage with people to be able to support the work that she's doing.
Dr. Cynthia has very strong commitment to her people, and also show a very great leadership role. And whenever we see her, she never, even though she's tired, but she never give up, and she try given to a lot of challenges with the program, and also the situation that make the people of Burma continue to seek the help, and service and support from her. And she always encourage and always inspire us as like the women activists, but also like the community level, and then also the role model of how the people from the community can stand up and then work together and build a change and build a better system and build a long-time sustainable system, a healthcare system for the future of Burma.
Do you see a particular role for women's leadership, especially with the changing context right now?
There's always a role for women's leadership. And it's about really trying to harness that. And I think the difference when you bring in women, you bring in the wider community.
It's been a big challenge because, the reasons why there were no women leaders at the beginning was because of traditional patriarchy, militarization. It's very difficult for women to break out of the cultural stereotypes. They're conditioned to be passive and not, assert themselves at all. Just stay at home, look after the family. But it's been the support for the development of women's organizations that I believe has really made a difference, because organizing in the space that women's organizations provide enables women to develop the skills and the confidence to become leaders in that sphere. And then when they speak out as leaders of women's organizations, then they start to be recognized by the mainstream, we could say, and start to be accepted as leaders in their own right.
Yeah, we really feel that the CEDAR support to the border is not only humanitarian assistance, it's also building the capacity of the new generation, or also building the capacity of the community, as well as building the system for the future Burma. We really need to monitor the real peace process. We have to look at different levels. Layer, like for example in the community level, the conflicts and displacement widespread. Another issue is refugees want to go back home, but they really want to go back to their land, or they want to stay with the family, not as a migrant labor again. So we need a lot of consultation and engagement from the civil society group to become really or true peaceful country in Burma. But until now, there are many civil society, especially women organization on the border, will still feel very insecure about all the military infiltration or economic exploitation happening in their community.
Do you think this will change soon with the changes going on in Rangoon and Naypyidaw?
It will take time because to change all the social context and strengthening the civil society groups, it will change. But especially the economic group is too economic investment too rush. So there has been not much dialogue and negotiation and the procedure and policy being established. So this can make more and more difficult for the community or the civilian group. They try to be strong, but it takes time to build the capacity and to negotiate and dialogue with the government. But in these cases, if you don't have enough capacity or strength, the conflicts will continue to happen in the community. So it is very crucial for us to make sure that every step of development make sure that the people participation and the people voice and equal access to the resources, whatever benefit.
The support that BRC has been giving to the many community-based organizations right from the very beginning since they were set up to now, many of them are very, very large operations with very large target communities. The support that was given at the very beginning for all the different needs to allow them to develop into what they are today was provided by Inter Pares from CEDA when no other funds were available. So it's been hugely important for the development of the civil society in Burma's border areas.
Is there anything else you want to add?
Yeah, as the leading agency like CEDA is for Burma issue for democracy and human rights, we really appreciate for all the support being providing for the border population, including health, women, advocacy, and human rights. And then it needs to make stronger role. We feel that a stronger role to deal with the Burmese government to make sure that the peace process will be sustained, and then the equal rights for all the ethnic groups as well as the civilian, enhancing the civil society role.
Okay, thanks very much.
Thank you very much.